Hey everyone, welcome to MyoLab. My name is Dr. Evan Schwintz. Thanks for tuning in. Kevin, let's get down to work. Today we're going to work on a hip hinge. It's a fundamental movement, picking things up off the ground, transitioning your movement from seated to standing, and quite frankly, often done incorrectly, leading to lower back pain. Okay, oftentimes we don't realize we're doing this incorrectly until we have extreme back pain, and then you realize your movement patterns are messed up. So let's get ahead of the curve and let's talk about a hip hinge. Important things to get into this position are make sure that lower back does not round. When we pick anything up, that lower back needs to be stable. So we can think of this like a shortstop position, coming down, sliding into this position, okay? Coming back up. And again, hip hinge, moving through the hip, not the lower back. You can also think about trying to close a cupboard door with your butt when you're sitting back. Go as far back as you can. Based on the fact that our society sits a lot, if you are trying to bend down to pick something up and you don't feel a stretch or a tension through your hips and your glutes, you're probably not doing it correctly, and instead you're using your lower back. Let's do a demonstration of what most people do when they sit down. How do they get back up? Push back up. That's a lot of knee load. That's why we see a lot of knee osteoarthritis, a lot of back pain problems as well. So the correct way to get into that again, think of it like a shortstop, pushing that cabinet door shut with your butt, coming down, nice and stable, no knee load, significant hip tension. How do we get back up? Don't load the knees, load those hips. Come back. Feel like we might be having some issues with this? Let's go ahead and grab a dowel, a Swiffer, a broomstick, whatever you might want to utilize. This will keep your body in check. Contact points are the head, the shoulders, and the tailbone. We're going to go ahead and lean forward as if we're picking something up. Come back upwards. Again, common faults are people round through their back. And you'll see how this affects the dowel off of that tailbone area. So again, now we go into seated position, sitting backwards, coming back up out of it. The simplest thing to remember, if you're sitting down, you don't feel hip tension, you're likely loading your knees and or your lower back. That might be feeling fine for you right now. But that moment when you do get lower back pain is when you're really going to start to notice and feel like, yeah, I should have done something about that a little bit earlier. Kevin and I want to take this time to personally thank you for watching today's video. Now, if you're in the Calgary, Alberta area, please be sure to check us out at myolab.ca where you can book online 24/7. We also direct bill to over 20 insurance providers for your convenience. We have a fantastic team here to help you out through any of your needs. If you have any questions from today's video, please be sure to leave a comment down below. If you like what you saw today, please be sure to smash that like button and share with any of your friends. Please also be sure to hit that subscribe button and follow us for our next video. You might see some other videos to the sides today that might benefit you as well. Lastly, please be sure to follow us on Instagram at MyoLabYYC. Take care.